for the change of the name or for the name of LifeStream to the name of the primary care clinic provider. Is a representative from LifeStream here. Seeing none. Kristen?
Yes, I'm not sure if there was going to be anyone here, but the original funding agreement said LifeStream Primary Care Clinic, and that is not the proper entity to enter into the funding agreement. It should have read LifeStream Behavioral Center, Inc., doing business as LifeStream Primary Care Clinic, a primary care clinic provider. So they have requested that we ask the board to amend the entity that will be entering into the funding agreement as far as their clinic is concerned. That's the only amendment we're asking for, or they're asking for.
Okay. Is there any question of that change, regarding that change?
Simple name change only.
Yes,
That's just for the,
from a corporation to doing business as their clinic.
if there are no questions, do we have a motion to approve this change?
Motion to approve the
Amendment. Second, all in favor, say aye.
Aye.
Motion carries. Thank you. And is there anything else that needs to come before the board regarding these items that we've already discussed and we'll voted on?
I don't have any other items. I would just point out to the board the scheduled meetings on the bottom of your agenda for the next 4 meetings.
And I do have an issue with meeting at 5:30 because I have another board meeting. It usually lasts until at least 5:15. Would it be a problem with the board if we change that to 5:30? Assuming it's not a problem with the clerk's office. 5:30, it would only affect 2 meetings, I think, the 2 remaining meetings. So if that's acceptable, would someone like to make that motion?
Change all of them or just 2 of them?
Change all of them. So you have a motion?
It says you're going to take control, Mr. Chairman, change all the meetings, I love it.
Just the time.
I make a motion to change our next 4 meetings to, from 5:15 p.m. to 5:30 p.m. on the days.
And do we have a second?
I'll second it.
Thank you very much. All in favor?
Aye.
Anybody opposed? No, that's, okay, thank you. Okay. So, on the board.
I would like to declare that there's my wife has been asked to serve in a voluntary position on the foundation for Cleveland Hospital and has accepted that, and I do not believe it's a conflict, but I certainly felt that
Good to disclose. Yes.
as a disclosure. I cannot see where it's a conflict of interest. Foundation board, our objectives are probably the opposite ends of the healthcare spectrum, but working at the same goals.
You don't have a problem with that. I guess if there is a conflict, she won't vote for whatever particular issue.
Still, she has no
Right, I believe the foundation is a separate entity from the funds that are being distributed to the Regional or Center for Health Alliance, so I don't see a conflict at the present time.
Okay. All right, thank you for that. Is there anything else that any board members would like to bring up this evening? And that being said, is there anyone in the audience that would like to speak this evening? Any particular issues? Wow.
I sent an email out. You mentioned LifeStream. Howard Wiener's had a transplant operation up in Jacksonville, so he's recovering. I talked to his office today, and he's doing fine. So hopefully he'll be back for many more meetings.
Thank you for letting us know that. There's no other items to come before the board. No items. I'd like to hear from Ken. Any comments? Anything?
You want to hear from me?
Sure, I do.
comment as well.
Well, y'all got
Well,
all the
then.
problems straightened out.
Yeah, we hardly got any, got settled when I was running these meetings in 12 minutes. I've been kept abreast of what's going on. Ms. Kirsty had forwarded me a copy of the report, and the report is self-explanatory in terms of what they're doing. I mean, I think that there's no question that the transparency issue that was being addressed with the legislation is being met. My only concern would be that the numbers are looking a little bit weak right now. You may have an issue you're going to have to deal with at the end of the year if there's not enough submissions to cover the amount of the taxes that was allocated to each provider. You're going to have to do something with the millage rate next year more than likely. And just keep that in mind. I think you guys probably already figured that out, but it sounds to me like there's not a whole lot of issues. I really want to give kudos to Moore Stevens and Lovelace for doing those webinars, because I know that I've had conversations with a couple of the members from the smaller providers, the primary clinics, and they were really struggling with getting information together and in a presentable format. So I think that that's been very helpful. And the fact he's going to do a couple more, I think, could only be better or help things even more. And I think that Arlen had mentioned before that it's a learning curve for his office as well. They're spending a lot more time on this than they had really had originally anticipated. And I think it's a learning curve for both sides. And at some point it'll be a well-oiled machine, but it's going to take some time. But I think that things are going as expected. Would be my comment.
And thank you, Ken, for all your hard work. Exactly. Mr. Madison.
I wasn't, Ken Addison, Port Hospital Fireman. I wasn't planning on actually making these comments, but because we have a little bit of time, I thought the board needs to be aware that the numbers that are being turned in are weak for a number of reasons that I think you as a board should be aware of. Despite us having added additional staff to try and process claims, we are finding that patients who benefit from the care that's being received, we're finding that there's a number of them that are not cooperating with the hospitals, so we're not able to qualify them for services. And that's a phenomenon, candidly, that not only is Florida Hospital Waterman having a problem with, but I'm understanding from Leesburg that they're also struggling with that very issue. Now, candidly, what do we do with that? Does the taxpayer benefit from that in the end with lower amount? And it gets added to the burden that the paying customers end up having to pay. That's something that I think we'll need to wrestle with over time. I know that the enabling legislation as it exists today requires what we're currently doing, and we're happy with that. But we're coming to realize that the unintended consequence of the letter of the law as it exists today is keeping the facilities that are providing this safety net care from being able to receive reimbursement for that care. Not because of our fault, but because of those who are receiving the care not participating or not cooperating with the process of documentation that we need. And that's a conundrum. We don't know how to solve that, but I thought that it might be appropriate for you as a board to maybe recognize that that is an issue that we're struggling with, and we sure appreciate your counsel on how we can best handle it.
I appreciate those comments, and it's certainly something that was not anticipated. I don't believe.
I think you're right. I think you're right. I also am very, very grateful for your service as board members that you give of yourselves so that health care can be provided to those who are disadvantaged, and I just wanted to say thank you.
Thank you. John, did you have any comments from Livestream?
I can give you an update from Livestream, and John Cherry, CEO of Livestream Behavioral Center in Leesburg. We did have a slow start, probably like most other folks, and that's even though We are fairly experienced in HICRA building because of the buildings primarily in Sumter County. But it is very difficult, just as Mr. Madison just indicated, to get the information from clients and to get their required signatures and the other things that go along with this process. We, again, did get a slow start because we didn't, I don't think we started collecting the information until August or so because of various things. But once we started, things did pick up, not in the first 2 quarters ended December 31, because my folks indicate that we've provided the information to the auditors now. We're waiting for them to come out and audit. But based upon those 6 months, we certified about $367,000 in gross charges. Now this Medicare cost to charges ratio, there's something quirky about it for us, and I'm not sure I know what it is yet, but I think my finance folks will, and they'll discuss it with the auditors when they come out. But ours is about 36%. And so that number, the Medicare actually reimburses us about twice that, or about 70% of those gross charges. So there's something there that the financial folks will look at and determine what the best answer is. But even with the cost of charges, first 6 months, we only had $132,000 worth. But in January and February, we had $200,000 worth. So it's fairly obvious to me that our folks in the hospital and the cost stabilization unit are beginning to know the process better, and I suspect are able to get all of the paperwork and signatures that are required. So it appears to me that we will have enough charges by June 30th to draw down the dollars that were set aside for us. On the other side, on the outpatient clinic, as you know, we did not get the LIP dollars. Most of those dollars went to big systems down south. And I think there was only $20 million available statewide. So we have not opened the outpatient clinic yet. We still want to. We're still exploring it. And I hope that we're able to open it sometime between July and September of this year in the Eustis area. And again, that outpatient clinic will serve primarily the individuals we're already serving for behavioral health care who, for many, many reasons, as we discussed before, don't get primary care services. So we're still planning to do that, but we've not had any billings for the outpatient piece yet. So that's where we are. And again, I also thank all of you for all that you do, your service, and between all of us, we'll get through this.
Learning curve.
It's a steep learning curve.
Any questions? Thank you. And is there anyone here from Leesburg who would like to speak? Okay, I suspect their issues are the same, so thank you.
Are there any other comments from the board?
There being none, we will stand adjourned.